My name is Dr. Brian Ray, and I am seeing patients at the Med Center at CMH, and I practice family medicine and OB. RSV is an acronym. It stands for Respiratory Syncytial Virus, and that's a big fancy word that means it's a virus that infects a certain part of the respiratory epithelium or the lining of the respiratory tract. Anyone can get infected with RSV. It's more common in children, and it's actually becoming more common in elderly people too. It can be dangerous, particularly the younger someone is, the more dangerous it is, especially under the age of 1. And so because of the way that it infects certain parts of the respiratory tract, that part is not as well developed in young children, and it can be more difficult for them to clear all the mucus and congestion that can be really dangerous for them in the way of breathing. The most common symptoms to look for are fever, cough, congestion, runny nose. The dangerous symptoms to look for would be something called retractions, which is where you can sometimes see that the belly is moving a lot with breathing, or you might see sucking in between the ribs. If you can see the rib bones, then that's a pretty concerning sign on their exam. If you think that your child or your baby has RSV, I do recommend getting tested for it. One of the things most of the daycares around and a lot of the schools will require a negative test or require them to be out for 5 days. And so if you think maybe it's not RSV, it's worth getting tested in case they get better quicker and could go back sooner. The reason to come in and get tested and get evaluated is to make sure that we're not needing any oxygen requirement and we're not getting dehydrated. Those would be the 2 things that are most dangerous in RSV. When do you need to come see a doctor? If your child's having mild symptoms, cough, congestion, cold, but you're not concerned that they're having any trouble with their breathing, meaning they don't look like they're breathing too fast, they don't look like they're sucking in between the ribs, they're drinking normally and peeing normally, then usually it's okay to manage those symptoms at home, and from a medical standpoint, they may not need to be seen by a doctor. But if you notice any of those would be pretty concerning signs. In young babies, we also sometimes see apneas, or babies stop breathing for a period of time. That's extremely dangerous, and that will be something that needs to be evaluated in the emergency room. For managing RSV symptoms at home, there are a few mainstays. Number 1, get a cool mist humidifier if you don't have one, and run it when they're sleeping or when they're napping. That can help to keep the nasal passages and the airways moist so that that mucus doesn't get too thick to run out. Next, nasal saline, drops or mist, it doesn't really matter which one, but spray it in the nose or drop it in the nose to try to loosen up some of that mucus, and then use whatever suction tool you like to try to suck as much of that mucus out as you can. That's really the mainstay of RSV treatment, is making sure that we can keep that mucus out of there so that kiddos can keep breathing normally. So for preventing RSV, the way that it's mostly spread is partly through droplets, so someone coughing on you or sneezing on you. RSV is also spread through contact, and so good hand hygiene, keeping things clean, especially kiddos in daycare, trying to keep them as best as you can from putting everything in their mouth and trying to keep those toys clean, doorknobs clean, those sorts of things can help to prevent RSV. There are vaccinations for RSV, and so pregnant women in their 3rd trimester are now eligible for RSV vaccines. Some children are eligible for RSV vaccines, especially if it's their 1st or 2nd winter of life. And then elderly people are actually eligible for RSV vaccines now too. And then other ways of preventing RSV, if you do have a small baby, everybody wants to love on them and kiss them, especially around the holidays, but kindly ask people to not get in your baby's face. And that's one of the biggest thing from a social standpoint you can do to help prevent RSV.